checking the MAR against the patient. Why? Right patient, but also right drug sheet, right? So if you check it against the doctor's order, it's possible you have the wrong drug sheet. So that's would be a flunk. It's an unsafe if you do that. So you take the MAR in your hand, and you're saying, so let me just check. Okay, this says your name is Ralph Johnson. Can you tell me your name, please? Ralph Johnson. Can you tell me your date of birth, please? And he'll give you the date of birth. Two identifiers are required by JCAHO standards. At North Bay Vaca Valley, it's the name and the date of birth. I believe at Kaiser, it's the name and the medical record number. Therefore, we will accept any two. We don't care. As long as you have two identifiers, we will care. It's important, though, that we see that you're actually checking what's on the MAR. I've had students that had the MAR, but they had it in the pocket, like this, and so they said, oh, okay, and I thought, what are you checking against? Because his name's down here. So they weren't really checking. So don't just go through motions. Make sure you really understand what you're doing. You have to be checking the document against this and also against what he says. Does that make sense? The next question is, now I'm going to give you some medications. Do you have any drug allergies? No, not that I'm aware of. Okay, thank you very much, right? Because you want to ask about drug allergies, okay? Also, the drug allergies should be here on the MAR, shouldn't they? So you just want to do another check. So we're down to number 5, okay? Perform any necessary assessments. So, Mr. Smith, I'm going to give you some medications here, but before I do, I need to check the heart rate and blood pressure. Okay. We will have a blood pressure cuff for you, and you will have your own stethoscope. We actually want to see you do it. So, it will be like this. You're going to take your stethoscope, and how do we listen to an apical rate, you guys? Okay, and so can we do it over the gown?
No.
Okay, so we don't want to see that. We want to see you actually go in there, under the gown, put it in the right place, and be trying to listen for a minute. When we see you've done right technique, we'll give you a number. You write that number right on the MAR. Okay. The BP, we want to see you open the cuff and actually put it on him. And then once we see you've got it on and that you're holding your stethoscope correctly, we will give you a number. But we want to see the mechanics of it before we give you a number. Then you stop and you write that number right down. We will repeat it if you forget. Okay? Why are we getting those numbers?
Safety.
So you would not give the med, right? It's whether or not. So what is the general parameter on when we hold the med? If an apical rate is less than
60.
Less than 60. What were you taught about a blood pressure?
110.
110 by
110 over 70.
What were you, you were taught less than 90. Anybody?
110.
Less than 110?
yeah.
Okay, we're going to go with a systolic less than 100.
Okay.
A systolic less than 100, I think, is what you're going to find on most MARs in most hospitals. So if we tell you the systolic is 98, we're going to say, if we tell you the systolic is 100 or 110, you may go ahead and give the med. Okay? We don't hold the med based on the diastolic rate. We base it on the systolic rate. Okay? So those are your parameters. Heart rate, apical rate less than 60, or systolic blood pressure of less than 100 are our parameters for you to hold the med. In the hospital, there may be some different ones, but in the absence of any specific physician parameter, that's what we generally use. Okay? Or at least that's where we report to the nurse. We would hold the med and talk to the nurse and see what she wants us to do. And a lot of times they say, make him get up, walk around, and check it again in an hour, type of thing. But for this purposes, you would hold it. Okay, so you write down, and you write down right in the block where you're going to sign off your med is where we want you to write these parameters. Okay, not next to where the name of the drug is, but in the box where you're going to give it or hold it, right there where you sign your initials, okay? All right, so you've done that, and while you're doing that, your instructor may sneak in and just very quickly check the meds to see that you pull the right meds. So we may, while you're doing that, just look. If you made a mistake, we're not going to tell you, but that's how we know, did you pull the right drug with the right dose, okay? So then you're ready to give them, and so then you say to them, okay, so I'm going to give you some medications, and it looks like I have 3. How many can you swallow? Oh, I can swallow 3. So, usually you have 11 meds, so you want to ask them, this is how many I have, how many can you swallow at a time? Because most patients can't down a whole cupful, even the most experienced ones. It's not a good nursing practice to do that because you're asking for trouble if they choke and aspirate. So you want to ask that. And then you say, okay, well, I'm going to sit you up here, okay? And so you want to raise the head of their bed to a position that's that's realistic. So we want you to actually do this, because if you only raise it a little, he could still choke. That's not safe. So you're gonna raise it up, okay? And then you can just say, how's that? Do you feel like you can take them? Yes, that's good, okay? And then you're gonna open up your nets. There'll be a water and a pitcher. They'll be empty, a cup and a pitcher, but they'll be there for you to simulate having water. So then you're gonna open up your nets, and this is your last chance to make one more check, so that if you made a mistake, you still have a chance to catch it, okay? So with your MAR right there, you just put them right there because they're in a package, and then you look at each one. Okay, so, Mr. Smith, the first drug I'm gonna give you is Pepcid, and you know that's for your gastric reflux. I understand you've had some heartburn. Oh yeah, I've been taking that for years. Okay, great. Then you actually, a good way is to hold the pill in your hand as you peel back, so this way it doesn't jump out at you, because I've got it in my thumb. And then you just hold it right over the cup. And you know, the next drug I have here is, this is Wellbutrin. I understand this is an antidepressant. You're familiar with that? Have you been taking it? Oh yeah, I've been on that for years. That's usually a push through. So again, you push, but you're holding control, and you're holding it right over the cup. Okay? And those are the two ways. It's either a push through, or it's one of these tear packets. And here I have digoxin. This is a heart medication. It helps to strengthen your heart and slow your heart. Have you been taking that? Oh yeah, I'm familiar with that. Okay, let's give you your digoxin. Right over the cup. Okay, so as you're pouring, we want to hear that you're explaining to the patient what the drug is. Very basic stuff, no big medical terminology, something a patient will understand. Why do you think we want to do that?
We don't want to scare them.
It's a good practice because they should know what they're getting, because patient education is one of the big things nurses do. What else? What else might it prevent?
Medication error.
Right, how would it prevent an error?
Because they could say, oh, I've never taken that before.
Exactly. Or, you're giving me 2 of those, I only take half. Oh, that's a red flag. What should you do if a patient says something like that to you?
Go back to
Double
You
check.
want to stop and say, well, let me check that, right? Well, let me, don't just say, well, it's here, take it. It's written, you know? That's the patient questioning you. Has that ever happened to any of you? Because it will. And sometimes it's because the doctor has made a change, and other times it's a different drug company, and so the pill's a different color, and sometimes it's a mistake. Okay? And sometimes it's not a mistake, but the patient says, I don't want it. Okay? Do they have the right to refuse?
Mhm.
They most certainly do. Okay? So that's why you want to educate them, just to make sure, not only because they should know their meds, but because it's a safeguard for you and the patient. Okay, so anyway, so here you go, you've got the 3, ready? And you just hold it up to him. Okay, he's taking it, and then water, and you're done, he's taking it.